Now in this video presentation, we are going to see how vitamin D is being synthesized in the body, and we are going to see the function of vitamin D also. Now there are two forms of vitamin D, vitamin D3 and vitamin D2. Now with the vitamin D3 is being synthesized from the precursor molecule, that is the 7-dehydrocholesterol, which is present in the skin, and the natural source of vitamin D3 is called and the halibut liver egg. And you can also find this vitamin D3 if the milk is being fortified with vitamin D. Now since vitamin D3 is being formed under the effect of the ultraviolet ray which is present in the sunlight, so northern country people uh, always tend to have less amount of D3. Why? Because the northern country people have got extreme amount of temperature, either very hot condition or very cold condition, and they tend to remain within their house. As a result of that, no ultraviolet rays and less amount of D3. Even the people who have dark skin people, they also tend to form less amount of D3. Now the source of vitamin D2 is diet, but largely from the vegetable are going to get vitamin D2. Now the body has got large store of this vitamin D, and it is located in the body fats. So in the body fat you have got having large pool of vitamin D, and only 1 to 2% of this vitamin D is being utilized every day depending upon the need. It is just like you are having large pool of vitamin T4 hormone. Okay, and whenever T3 is required, T4 is converted into T3. Now, what is the difference between vitamin D3 and vitamin D2? If you see the molecule, there is only differ only in the side chain of ring D. Now whether it is vitamin D2 or D3, it takes synthesized from the cholesterol molecules. So we can say that the cholesterol molecule is the backbone for the synthesis of D3 and D2. Now please see that especially what is the difference between vitamin D2 and D3? The side chain which is being attached with this D, the only difference between D2 and D3 is about the difference of this side chain. Okay, so please remember that when we are saying 25 hydroxycalciferol, that means something is there at the position of 25. When we are saying 24-25 dihydrocalciferol, that means we are saying at the position of 24 and 25. Okay, so the difference, main difference D2 D3, only the side chain. This is the side chain which is being attached in the benzene ring of D. Now these two are the molecules of vitamin D2 and D3, and just see in that this is the D portion. Okay, so just see the difference in the side chain. Everything remain same, only the because of the difference of the side chain, it is been known as vitamin D2 and D3. Now under the effect of ultraviolet rays in the sunlight, this dehydrocholesterol, which is provitamin D3, is converted into vitamin D3. So this is the precursor molecules which is converted into vitamin D3 under the effect of ultraviolet rays. Now as I've already said you that melanin and the keratin pigment which are present in more amount in dark skin people, it is going to affect the formation of vitamin D3, and these people who are dark skin will tend to form less amount of vitamin D3. Now vitamin D3 is being obtained or derivatives of cholesterol molecules. Okay, now on the other hand, if you see the synthesis of vitamin D2, okay, now whether it is D3 or D2 is there, again see that the difference is only in the side chain which is attached to the D benzene ring. Okay, otherwise everything is same. So how this is being formed, vitamin D2? Now vitamin D2 again is being synthesized from its precursor molecules, ergosterol, okay, under the effect of sunlight. Okay, now this reaction is completed, that from its precursor molecule it is converted into vitamin D3. Now this reaction is incomplete. Now apart from D2, more than 15 different types of molecules is also being formed over here. Okay, like vitamin D is there, vitamin D4 is there, and these vitamin D1 and D4 and other protein molecule which is being formed here is devoid of vitamin D physiological activity. Now we are going to see what will happen when this vitamin D3 through blood comes to the liver, and then it goes to the kidney, and finally the active form of vitamin D3 is being formed. So when it is coming to the liver, okay, what is happening in the liver under the effect of certain enzyme? Okay, what is happening? We have got hydroxylation reaction. Hydroxylation means oxidation happens. Okay, so carbon hydrogen bond oxidize into carbon hydroxyl bond. So in when this vitamin D3 is arriving in the liver, there is the addition of one OH group, where it is being added at the position of 25. Okay, now when this molecule goes to the kidney under the effect of parathyroid gland, a second OH group is being attached at the level of O position of 1, again under the effect of certain enzyme. So over here cytochrome 450 enzyme, including the CYP2R1. Okay, now if there is a mutation in this enzyme, that means the hydroxylation is not going to take place. In the same manner, in the kidney also, these are the name of the enzymes. Okay, now if there is a deficiency of this enzyme is there, then again hydroxylation is not going to take place. Okay, for the production. So if this enzyme deficiency, or if parathyroid hormone is not there, second hydroxylation is not going to take place, and the active form of vitamin D is not going to form. Now this is a highly regulated reaction in the kidney, but on the other hand in the liver it is not a regulated reaction. So vitamin D3 is being formed in the skin under the effect of ultraviolet rays from the sunlight. Okay. Now this vitamin D3 is converted into 25 hydroxycalciferol. Okay. Now this is a rate limiting reaction. Okay. Now when this 25 hydroxycalciferol is being formed, okay, it itself inhibit the formation of vitamin D3 into this form. Okay, now there is a two clinical importance for the inhibition. Why? Because once if this molecule is being formed, okay, its effectiveness is only for few weeks. Okay, secondly, when we want these molecules to be in a very normal limits, okay, we don't want to form these molecules beyond the normal limit. So when normal limit is being reached, okay, within the normal parameter, this molecule itself inhibit in the liver for the formation of these molecules. And what is happening by the inhibition? Large amount of vitamin D3 can be stored in the liver for many months. Okay, and when required, again from the liver, this 25 hydroxycalciferol can be formed. Okay, now when this 25 hydroxycalciferol is being formed, okay, it goes to the kidney. Okay, now in the kidney, what is happening? In the kidney under the effect of this parathyroid hormone, okay, under the effect of this hormone and under the effect of certain enzyme that we have discussed in the previous slide, it is converted into this active form of vitamin D. This is the most active form of vitamin D. Okay, so what does this vitamin active form of vitamin D do? Now it have got three functions. It goes to the bone, and in the bone what does do? It help for the reabsorption of the calcium from the bone. Okay. Now in the kidney itself we are seeing what is, we are seeing under the effect of this hormone there will be reabsorption of the calcium from the renal tubules. And secondly, this vitamin has got, will go to the GIT system in the intestine, and from the intestine it is going to reabsorb large amount of calcium. So under the effect of parathyroid hormone does not have a direct effect on the GIT system. Rather, parathyroid hormone will stimulate the kidney for the increased formation of increased amount of vitamin D, and this increased amount of vitamin D3 will go to the intestine for the reabsorption of the calcium. Okay. So here we can see that this active form of vitamin D is going into the intestine. Okay, and by certain mechanism, what is happening? The intestine absorption of calcium is being increased, and again bringing towards the normal level. So if the plasma calcium ion concentration again if decreases, okay, what is going to happen? Again what is going to happen? Decreases, and so parathyroid hormone is going to be increased. So parathyroid hormone synthesis or parathyroid secretion will take place only when there is a decreased amount of calcium is there. Now the intake of vitamin D3 from the diet, okay, can vary. Sometimes you tend to take large amount of vitamin D3, sometimes you tend to take low amount of vitamin D3. Okay, but the amount of plasma 25 hydroxycalciferol, okay, remain constant, okay, irrespective of the amount of D3 that you take. Okay, because we want this thing to be in a normal range. Once if this is being formed, it can work for only few weeks. So if you take large amount of vitamin D3, what is happening? It is being stored within the liver for many months, and when required, this D3 is being again converted into this form. Now suppose if there is a decrease in extracellular calcium, so there are certain mechanisms by which the decreased amount of calcium will be increased. Number one, this decreased amount of calcium through negative feedback, it will stimulate the parathyroid gland to release the parathyroid hormone. Okay, now the parathyroid hormone is going to affect three organs. Number one, it will go to the bone for the increased reabsorption of the calcium ion through the osteoclast and the osteoblast cell, which I have already discussed. This parathyroid hormone will again go to the kidney, okay, and from the kidney again there will be a large amount of calcium reabsorption, and again vitamin D3 will be formed in large amount in the kidney. Now this parathyroid hormone does not have a direct effect in the intestine, rather it is acting through the kidney. So this will stimulate the kidney to form large amount of vitamin D3, active form of vitamin D, and this active form of vitamin D will tend to increase the absorption of calcium from the intestine. Okay, so thereby increasing the low amount of calcium in the plasma. Now if there is a decreased amount of calcium ion in the extracellular fluid, okay, then this decreased amount of calcium will, what it is going to do, it is going to stimulate the parathyroid gland for the production of parathyroid hormone from this parathyroid gland. Okay, now if the calcium level is increased, then it is going to inhibit this parathyroid gland, and as a result of that, no parathyroid hormone secretion will take place. Okay, so in response to low amount of calcium in the calcium in the plasma, what is happening? this parathyroid gland is being stimulated and parathyroid hormone is being secreted, which is going to work on three main organs. Number one, it is will go to the bone. Okay, within the bone, what is going to do? It is going to increase the absorption of the calcium from the bone under the effect of osteoclast and the osteoblast cell. Okay, when the calcium is been reabsorbed from the bone, what will happen? There will be increased amount of calcium in the plasma. Okay, this is the first mechanism. Now this parathyroid hormone will also stimulate in the kidney, will go to the kidney, and again what is happening in the kidney? There will be a large reabsorption of the calcium. So again the extracellular calcium is being increased. Now, one more effect is there in the kidney. The parathyroid hormone does not have a direct effect in the intestine. Okay, rather, what is happening? Under the effect of parathyroid hormone, there is an increased amount of vitamin D3 formation is there. Okay, the increased amount of vitamin D formation is there from its precursor molecule. So there is an increased amount of uptake of this molecule which is coming from the liver by the kidney, and under the effect of this enzyme, lot of active form of vitamin D3 is being formed. Okay, and this active form of vitamin D will stimulate in the intestine to absorb large amount of calcium and thereby again increasing the calcium level. Okay, and this enzyme can be inactivated by this enzyme. Okay, so this form of vitamin D is being formed which does not have any physiological effect. Now, due to the deficiency of vitamin D in the children, it produces a disease known as the rickets. Okay, now what is happening in ricket? The bone has got an abnormal amount of the unmineralized osteoid. As a result of that, what is happening? There is a bowing of the long bones of the leg in the children. Over here, you will able to see the normal alignment of the bone, and over here you can see the bowing of the bones. In adult in the osteomalacia, since the longitudinal growth has been completed, you will not going to find the bowing of the long bones. So bowing of the long bones due to the deficiency only we're going to find in the children. Okay, but in the adult there is a due to deficiency of the vitamin D, you will find decline in the bone strength, and these people are more prone for the fracture of the bone. Thank you.